Psychetruth. Life, wisdom.
Hi everybody, this is Gregory Gorey with Bodywork Masters, and today we're working with Joy. Joy is a gymnast and she's having some low back pain, and what we're going to demonstrate today is how to make sure that the pelvis is in alignment and the sacrum is in place. And this is something that I do with pretty much every one of my clients. Getting a level sacral base and making sure that one hip isn't higher or rotated or the sacrum is twisted. We just want to make sure that that's all level and then see what happens to her pain level after that. But as I said, pretty much everybody in my practice walks out. I aim to make sure that they're level in this way. So the first thing we're going to do is we're going to check to see if her hips are level. And once we have that information, we'll check to see if she has what's called an upslip. And what an upslip is the sacroiliac joints, when she bends over, should be opening at the same time. If I've got my hands on her PSIS and one moves before the other, we know that she has an upslip there and that joint is jammed. So we're going to do a gentle muscle energy technique to unjam her if we find that. So the first thing we're going to do is let me have you stand up and turn your back to the camera. Alright, so what we're going to do is we're going to take the thumb and we're going to feel up to the top of her hip. So that's the top of one side, feel until you get to the top of the other side, and then compare. And with Joy, her right side is just slightly higher than the left side. I mean, it's probably 1/8 of an inch or less. It's not real significant. But what we're going to do now is we're going to check her in a seated position. So Joy, let me have you sit down right there. And we're going to do the same thing here. Looking on this side, looking on that side, and there you see a significant difference. So this side, when she sits, is 1/4 to 1/2 an inch higher than her left side. What's important about that is it has therapeutic value to know the difference. If she's seated and the hip height discrepancy is greater than when she's standing, then what that tells you is she's got something right here that's pulling the hip up. Probably her quadratus lumborum, which I'm about to release. But if she had been standing and the leg length difference, or not the leg length difference, the hip height difference was greater when she was standing, then that would say that something on this left hip was pulling this left hip down. So keep that in mind. That's the key point of doing a standing and a sitting assessment. If it's worse when she's sitting, then this side is being pulled up. If it's worse when she's standing, then this side is being pulled down. So because this side is higher sitting, I'm also going to check for an upslip of the sacroiliac joint with her seated. Joy, what I'd like you to do, I'm going to first find the PSIS. The PSIS is this little bony landmark, so it's where the sacrum and the hip meet. So that's one PSIS, that's the other PSIS. Now I'm going to put my hands there gently. And Joy, let me have you tuck your chin toward your chest and roll down for me slowly. And there, I just felt a little bit of motion on this right side before I felt it on the left side. So she has a right upslip, and we're going to correct that as well. So Joy, go ahead and get on the table, laying on your back. All right, so we've determined that this right hip is being pulled up because it's worse when seated. You can treat the quadratus lumborum from the back, but generally speaking, there's a lot of fascia here, and a more efficient way to get to the QL is actually from the side. This can be intense for some people, and it can also, if they're ticklish, you might get a little bit of a reaction, but this is by far the most effective way that I've found to get into the QL. So to get into it, you're going to come up to the top of the hip, right there, and then I'm going to take her feet and I'm going to stretch out the QL so I've got a little space to get into, and then as I shorten it and I bring it towards me, my lower hand is diving in, and that looks, is that tender or ticklish? It's a little ticklish for her. So we're just hanging out here. There. She just let go a little bit. Ticklishness, by the way, can also be a sign of dysfunction. Sometimes when we're really goosey feeling in any particular spot and you have the person go whoa and try to get away, sometimes that's a defense mechanism by the nervous system, because it actually recognizes that there's pain underneath, and if you were to go real hard, it would be painful. So instead, the body goes whoa, and that's the tickle response, trying to get away from what the nervous system thinks is a perceived threat. So we're going to do that one more time. I'm going to come up to the top of the hip. You okay? All right. So we're going to stretch it out, and then I'm going to dive in to the level that she'll let me there. Good job. And we're just going to hang out here 15-20 seconds. I'm doing a little bit of motion, but I'm mostly just still diving into the QL. So releasing this QL should lower her right hip down and drop it down. But the next thing we're going to take a look at is the upslip. So we found that her right SI joint was moving before her left SI joint. So we're just going to try to create a little bit of space in that joint. So from there, we're going to come, and I'm going to take this leg, and I'm going to gently do a light traction with it. And Joy, what I want you to do, I'm going to pull you here. I'm just going to pull this down to the first motion barrier. And now, Joy, what I'd like you to do is to pull against me. So you're going to pull, yeah, perfect. 3, 4, 5, 6, 7, 8, and relax. And then a little stretch. And pull it up again. 1, 2, 3, 4, 5, 6, 7, 8, and relax. And a little stretch. Now, with muscle energy techniques, there should never ever be any pain. And sometimes you'll have clients that will try to overpower you. They really only need to be exerting about 20% of their muscular force in order to stimulate the stretch response. So we're going to come here. I'm going to do one last one. I'm going to pull down, stop at the motion barrier. Let me have you pull up with that hip. And we're going to hold that for about a count of 8 and relax. And then after she relaxes, there's one more stretch. Good. So that is getting her sacroiliac joint to open. And you can also take one side to the other and just feel, yeah, that feels pretty smooth. Now what we're going to do is we're going to check to see if her pelvis is rotated forward or back. So Joy, let me go ahead and have you turn over onto your stomach, and when you do that, let me have you go face down, but I want you to not turn head. I want you to put your hands right here, and yeah. So if we had the headpiece in, we would put the headpiece on, but if we're just doing this real quick, we don't want her head turned to the side because that's going to have an effect down the rest of the spine. So we just want her head level. So what I'm going to do is I'm going to come down, and with my dominant eye, I'm going to look down the center line of the body, and then I'm going to put one hand on the upper part of her glutes, and I'm going to see, are they level? So is one hand higher than the other? And with Joy, her right side is a little bit higher, so her pelvis is doing this. So now what we're going to do is we're going to check and see if the hips are level or not, or if the hips are rotated. So is one side higher than the other? To do that, you need to put your dominant eye over the center line. So go right down the center line, put one hand on each of the top of the glute max at its highest point. So her right side is higher than her left side. So her pelvis is actually rotated this way, and that's why this side is higher. So how we're going to correct that is another muscle energy technique. So I'm going to take this hand and I'm going to clamp down on her SI joint here. I'm going to take my other hand and I'm going to grab her ASIS. Her ASIS is your hip pointer here, the bony landmark there. So coming in, grabbing here, this hand comes down, and then I'm going to gently rotate this hip up to the first motion barrier. And Joy, let me have you, 20% of your effort, pull this hip down towards the table. 4, 5, 6, 7, 8, and relax, and then a little stretch. And let me have you contract again. And relax, and a little stretch to put that back in. And one last time. 4, 5, 6, 7, 8, and relax. And stretch. All right, so let's reassess that. But I've just pulled her hips back. So what I want you to do, Joy, is to lift your hips up off the table and then put them back down. That way we can have an accurate measurement. I'm going to come back, and she's level. Okay, so we got her hip to drop down. We got this joint to open up, and now we've leveled the sacrum. The pelvis. The last thing that I want to check is actually the position of her sacrum. So from here, I'm going to come and I'm going to find that same place that I found before, the ASIS here, ASIS here. That's the edge of the hips as they meet the sacrum, and then I'm going to come in just about 1/4 of an inch, and I'm looking for a little hollow spot that's called the sulcus. So as I come onto the sulcus, I'm looking to see if one is deeper than the other, and in fact, her right sulcus is slightly deeper than her left sulcus. Let me have you come up onto your elbows for a minute. This checks the sacrum in extension, and that's fine. She normalizes when she comes up into extension. Let me have you go back down. Reassess one more time. Yes, and her right side is a little deep. So what we're going to do is we're going to de-rotate that. We're going to twist the sacrum. There are actually a couple of ways that we can do it. Actually, check that. I'm going to instead treat her iliacus. Because the iliacus actually attaches onto the sacrum as it wraps around, and we want to figure out why is the sacrum dropping? So I'm going to reach around with my hand with her body there. And actually, I don't think the camera angles will show this. So go ahead and turn back onto your back. And the iliacus forms on the inside of the hip and reaches all the way back and around to the sacrum. So what we're going to do is first we're going to do just a little myofascial release. I'm going to take this hand up, this hand down, and just get a little opening of those fascial structures. And then I'm actually going to go in and dive down into the iliacus. And with this, we're just kind of melting taffy. There's not a lot of movement, not a lot of action. My hands are going in opposite directions. A little bit of a burn there. This can be a real sensitive area when doing myofascial work. It's pretty interesting feeling like the difference between how that feels and the kind of skin burn that you might be experiencing, and doing this here, which is the exact same amount of pressure, but the inguinal ligaments tend to become a little fascially bound. All right, so we did some light myofascial work. She's not real happy with me right now because there's a little bit of a burn going. And then we're going to actually drop down into the iliacus. So to get into the iliacus, we're going to shorten the muscle and have a little bit of a rotation. There you go, that's perfect. And then I'm going to, we're going to attempt to do this. We'll start off real slow. Gonna just drop down, big breath. And I'm not going hard, it's just ticklish, but this is an important muscle to learn how to treat. We tend to live in a very flexion-dominant society, and your psoas and iliacus are one of the primary muscles that gets chronically shortened. So it's good to learn how to get some length in there. Doing great. There we go. There. She just relaxed. I felt my fingers drop down. Now what we can also do. Okay, so earlier we were talking about ticklishness and what that can mean. That the nervous system knows that there's some tenderness there, and it's trying to get away from that perceived threat. And generally, like, okay, that tickles and you move away, that's one thing. But if it's a real, like, woo, goosey, that's probably a sign of dysfunction. So what we're going to do is a counter strain technique, and we're going to counter strain her for a minute or so, and then we'll recheck her iliacus and see if it's less goosey feeling, okay? So how we're going to do that is we're going to shorten this muscle. So what I'd like you to do is to cross that leg over, and then that is her iliacus is now maximally shortened. This is a counter strain technique. Basically, counter strain, what you're attempting to do is to get whatever muscle that you're trying to treat to relax by putting it in a fully contracted state. So if you had your bicep, for instance, because it's easier to demonstrate. If your bicep was in spasm, or it was feeling like you touch it and you get that goosey feeling, the counter strain for the bicep would be just to do this. And basically that's all there is to it. You just hang out in a fully contracted state, and it gives the nervous system a chance to reset and go, okay, it's cool, nothing's going wrong here. So we're going to hold this contracture, the counter strain technique, for her iliacus for another 15-20 seconds, and then we will go back into the iliacus and see if it made a difference with the goosiness. All right. Let's do another 5-10 seconds. And all right, let's try that again. So we're gonna go ahead and lengthen that out, and then coming back, shortening it a little bit. You can let her leg rest on your body if she's wearing clothes. If it was in my practice and she was under a sheet, I could also just put it here, have her draped, and you can actually go through the sheets. All right, so nice and slow. And she's still a little reactive, but I don't feel her clenching underneath my fingers as I'm dropping down into her iliacus. Is that easier this time or about the same? A little bit easier. That's code for not that much. but it is. I can tell the difference when I'm dropping my hand in there, that she's allowing me to get a little deeper. All right. So that was all in order to try to put her right sulcus back into place. Let's have her turn over and we will recheck her sulcus. Go ahead. All right. So always when doing structural work, you want to make sure your dominant eye is over the center line. Her center line is her spine, so my eye is lined up directly over it. Then I'm going to come to the PSIS, and then come in just a tiny bit over to the sulcus, and that's better. So now her sacrum is back in place. So from there, let's make sure that your hips are level, and whenever you do a test, always retest, because if you don't retest, then there's no purpose in having the first test. If you're trying to find out are her hips level, and you do a test and you don't do a follow-up test, you don't know if you put it back in. So let's have you come on over, and you're going to sit on this chair again. All right, so we've established that her hips are derotated. We rechecked that. We rechecked her sulcus. Her sulcus is level with her other sulcus on her sacrum, and now we want to make sure that the upslip is taken care of and the hip heights have been regulated or brought back to balance. So coming up, you're going to feel bone, bone, bone. As soon as you're on top of the bone, that's where one thumb goes. Bone, bone, bone. Thumb goes there. And that is level. Her hips have dropped down from releasing that QL. The last retest that we want to do is for the upslip, so we're going to come to that ASIS joint again. ASIS joint, that's where your sacroiliac joint is. And now let me have you tuck your chin in toward your chest, roll down for me. Perfect. The joints opened up at the same time. Alright, well, I hope you enjoyed this little tutorial about sacral and pelvic stability. It's important stuff. It's one of the few things that pretty much everybody that comes into my office, when we check them out, I always check to see how the hips and sacrum are balanced. Well, I hope you enjoyed this video. Don't forget to like and subscribe. And if you have any other requests or topics that you'd like to talk about, feel free to let us know in the comments down below. Check us out, bodyworkmasters.com.